This last Friday.
What's the name?
So you should do like 3 months before
Good morning, everyone. Sorry, I'm a little bit behind schedule. Happy Thursday. Glad to see everybody. What we're going to do is we are going to make this real, I won't say quick, but we're going to go through our Pledge of Allegiance, our 4-way test, and our speaker today. So we'll do our presentation, and then we'll turn it back over for usual club business, okay? Because she has a meeting in about 24 minutes. So we'll go ahead and get everything started. Ken, if you want to lead us in our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our Heavenly Father, we thank you for this new day, and we thank you for all of the many blessings that you have given all of us. We thank you for Rotary and ask that you help us continue all the good work we do in this world. Again, we thank you for everything that you have done for us. Amen.
We'll go ahead and transition to our 4-way test. Things you think, say, or do. First,
Is it true?
second,
Is it fair to all concerned?
third,
Will it build goodwill and better friendships?
fourth.
Will it be beneficial to all concerned?
You may be seated, and thank you. All right, well, I would like to introduce our featured speaker this morning. She's actually a previous speaker that we had in 2020. What year? 2021.
Yes.
You visited us last when we were at Friendship. So she's here. She's actually with a new organization. It's called City Block. And so since we have her here, we'll go ahead and let her take the stage. So give her a round of applause.
I'm a short girl, so I'll stand over this way.
I feel you.
Thank you for having me today. I'm actually going to stand over here if you don't care. So a little bit about City Block. City Block was formed in 2017 in New York by Dr. Toyin AJ and some high-tech investors. She, along with the high-tech investors, knew our healthcare system was failing as we knew it. She was a doctor for the United States, and she actually created hospitals over in Africa too. So she has a broad spectrum of healthcare knowledge, and so, like I said, she formed with healthcare high-tech investors, and they formed City Block Health. So that was 2017. That brings us to today. They started in New York City. Today they are a Fortune 500 company already, taking the changes to healthcare. So how that looks is we are now, and what I'm about to tell you needs to stay in this room for right now, so please don't share the video until this goes to media. But we are launching in Indiana. We were hoping to announce it yesterday, however, all of our production and media was not ready to release, so you guys are hearing it before the rest of the state hears it.
Why would we live stream this?
So what that means is the state's approved it, it just hasn't hit media yet. So City Block right now is in New York City, North Carolina, Ohio, Washington, D.C., Massachusetts, and Connecticut. So we're extremely happy to bring it to Indiana. Where we're launching first is Fort Wayne in Indianapolis. So what City Block does is we come inside of Medicaid companies. So we take the sickest of the sickest from the Medicaid companies. They give us their high entity members, okay? The ones that are the most sick in need and have the most social economics. So what happens then is we come in beside them and we do full wraparound with them. So as we know healthcare now, part of the reason it's failing is when you go into a doctor's office, a lot of times we don't look at what could be holding you back. So we know maybe a diabetic is not taking their medication, but we do not know why. They just, unfortunately in medical field call them non-compliant. Okay, a lot of times it's what they get labeled. That's really not the reason. There's another reason behind it. Nobody wants to not take their meds. So it could be they, it's an elderly person, unfortunately they're on a fixed income and they're having to choose, food over their medications. Or, vice versa, many different things are happening in their life. So what we do is we come in, so I have a whole team behind me. So I'm the Indiana Marketing Manager. So behind me is we have RNs, we have medical assistants, we have nurse practitioners and PAs, we have medical doctors, we have psychiatrists, psychologists, mental health workers, pharmacists, paramedics. So how that looks then is we, fully wrap around them. So what happens, from the very beginning? So what happens from the very beginning is, we try to impact members by who we are. And so nobody's a one size fits all. Every member, we make the CEO of their own path, okay? And we walk beside them. So what happens is, starting next Monday, members that their insurance company picked them to receive our services will start to receive letters in the mail, texts, that kind of stuff. 7 days later, my team will start making calls. If we can't get a hold of them, we go to their houses. We do not give up on these people. By all means, we will search them out. We have ways to call the pharmacy. We have systems to look where they are. We're in touch points with the hospital that we get pinged the minute they're in the emergency room or if they get admitted to the hospital. And within 24 hours, someone from City Block is sitting in their room to fully wrap around them. So we also help the hospitals. So for instance, the hospitals have been saved in New York City. I think last year it was $1.2 million in Block saved New York City's healthcare system by keeping people out of the hospital. So my background is nursing. Some of you might remember that from when I was here last time. I ran the family planning clinic here in Evansville for quite a while. So I know how important that is because hospitals are so stretched thin between nurses and social workers. So what we do is come alongside the social worker and we help discharge that patient and keep them at home. How that happens also is we have paramedics. So say someone calls and they're like, we have a 24/7 number. They have a provider on the phone within 2 minutes, and they're calling. They've just been discharged from the hospital, and they're like, I'm not feeling right. I can have a paramedic in their house within 20 minutes. We have our own paramedic teams. With the doctor, live streaming with the paramedic. Sometimes we can't always help. We will have to take them back to the hospital, but I will say 80% of the time, we reduce hospital readmissions by going into the member's home and taking care of them there. We know mental health is a big crisis in Indiana. I can tell you 89% of my population, I'm bringing on 11,000 members this week. 89% of them have a mental health and substance use diagnosis disorder here in Indiana. So harm reduction is a big tool we use at City Block, along with, like I said, we have mental health workers, we have crisis workers, we have psychologists, we have psychiatrists. If you work in the mental health field like I have prior to this, you will know it's usually at least a 30 to 60 day window when someone's discharged from the hospital to get them into a psychiatrist or psychologist. I can have someone in within 3 days, 48 hours to 72 hours with one of our specialists. So again, it's not open. I'd love to say City Block was open to the general public. It isn't. Your insurance company has to pick you to receive our services. And then once they do that, we reach out to you and we fully wrap around those, high clientele. Now, if you're asking how City Block became a Fortune 500 company doing this, is because it's been proven healthcare and that we save the insurance companies money. So between the high-tech investors, of course, the hospitals, the insurance companies, all, contribute that proportion to City Block then, of course, because they're saving such healthcare. In the end, when we save the states and the healthcare systems, that comes back to all of us, because all of us with commercial insurance, unfortunately, that's why you see, such the high premiums when we go in for a CAT scan or anything else, because hospitals are billing more because they have to recoup that money somehow. So when they don't have to go back and recoup that money, it saves all of us in the end, And it gets these people, it gets members that are especially, poverty and minority health, into better healthcare systems. We know they have been struggling for a long time. I can tell you, I went into nursing in 1997, and I have definitely seen poverty and minority healthcare suffer. Dr. Twain just did special with Oprah Winfrey on COVID, especially for minority healthcare. So I tell everyone, please watch that episode, Google it. Oprah did a wonderful job on especially shedding the light on, again, poverty and minority healthcare and how it's failing here in America compared to other countries. So that is where City Block's focus is. And then, at the end of the day, it's a win for everyone. It's a win for not only our members, but the insurance companies and then the states. As we all reap benefits of recouping and saving money. Yes.
So is the mental health and drug problems, are they growing locally, or are they getting better locally? Like, kind of what's the good
Now, unfortunately with COVID, we have seen a more increase and spike in every state, but Indiana, I also sit on the ZIP Coalition with Governor Holcomb for Indiana, which is the ZIP Coalition is Zero and Positivity. And we have seen a major outbreak in STDs, HIV, all of that is stemming from Evansville alone. I'm sure you all saw in the paper, had a major syphilis outbreak. I will tell you, when that outbreak hit, I was running the family planning clinic here. I have been a nurse since 1997. I had never seen syphilis up till now in my whole career. So Evansville, and it's still not under control. I was just on the state meeting 48 hours ago, and it is still not under control. And we have traced it back, and this is well-known news, I'm not telling you anything you can't look up. We traced it back to Jimtown, and most of it was substance abuse.
So do you have statistics on that? Like what percentage has changed? Is it like 1%, or is it like doubled, or?
It has doubled since COVID.
Okay.
You talk about the insurance companies saving money, but Medicaid doesn't, those people don't use insurance. They don't have supplemental insurance. Medicare does. But
Yes.
So, and I can understand how they do it with Medicare, because the government's going to spend $22,000 per person to do this, and an organization will say, we'll do it for $15,000 and we'll take care of everything, and we'll take 100,000 patients at $15,000 apiece and save you that $7,000 for every person, and we'll do everything.
So Medicaid does actually have an allotment per person.
Is that how they do it?
Yes.
They're doing the same thing.
Yes.
Okay.
So Medicaid should be, they would like to see, I'd have to Google this again because I don't want to give you wrong numbers, but I think it was something like $8,000 a year per person is what they'd like to stay under, and it was nowhere near that. We were seeing $50,000-$60,000 a year. That some of your high acuity, unfortunately, Medicaid members, and it wasn't always substance abuse and mental health. Some of it, unfortunately, was diabetes, COPD, those kind of diagnoses, because unfortunately people were having to pick medications over food or housing over food. And COVID, unfortunately, made all this a lot worse. People lost jobs, they lost incomes. I saw people that had never needed to use the system during COVID, unfortunately, have to use it. They had no clue how to use it even. So unfortunately, COVID really took a major toll in our country, especially in mental health too. And so when it came to mental health and people were stuck, in their homes for months or without jobs and didn't know where to turn because they never needed to use the systems before, and just that, like, I want to say where everybody was, people were meant to be with other people. We're not meant to be stuck in homes or even the ICU, we saw that as I was a former ICU nurse, and I worried about mental health from the beginning, because if you've ever been an ICU nurse, you will see that people, families coming in definitely help our patients heal faster and better. We get better outcomes. Unfortunately, families couldn't be in there with their loved ones. And my nurse friends, I was no longer in ICU, I was running the family planning clinic here, but they weren't pretty much astronaut suits, you know? So people weren't able to get that touch and that love and care that we could normally give if the family couldn't make it in. They weren't getting that, you know? So we saw such a decline. These people came out with, if they did survive the ICU, major PTSD.
Oh,
So I worked in nursing home care throughout the pandemic, and the amount of deaths that we had just from depression, major depression disorder, significantly increased. It wasn't even, we didn't have our first case of COVID until the following October in my nursing home. So it started in February, and we didn't have our first case until October. And we had shut down completely because of it. We weren't allowing visitors, and within that time frame, I think we had 5 residents that passed away from anxiety and depression just from not being able to see their family.
Yeah.
But I do have a question. So are you starting with this specific payer source with those 11,000? Are you starting with Medicaid and then working your way up?
Yes, we are. I am not at liberty. You will be seeing in the media who the Medicaid source is. I am not allowed to release it yet today.
Okay.
But there is a specific Medicaid source that we are contracting with.
Is there a certain age group? Are you starting with the senior population 65 and older, or are you starting with all ages?
So 18 and older. So we
18
will
older.
take him. We'll take Hoosier Health Wise. Hoosier Health Wise, so not the children. That's going to be your pregnant limit.
Right.
You know, so 18 and up. So we are not doing pediatrics. North Carolina, we do pediatrics. Indiana, we are not doing pediatrics at this time.
Cross point. Operating by defense. People are step on somebody else's property and there's an order that they can't do that. They get arrested. They get put in jail. The judge sends them, or they're acting irrational. They're sent to cross point. None of them ever see a psychiatrist. How are they gonna impact something like that? Or can you guys help that? None of them. None of them. They're lucky to see a nurse practitioner, but never get to see a psychiatrist.
Yeah. So again, if they would be our member, we would get a ping that they were admitted, and within 24 hours.
So you only are going to work with those people that become members.
By their insurance company. We do not pick them. That's the biggest thing I want you to understand. City Block has no control over that. It's through the insurance company. Now, when I tell you that though, members can call their insurance companies and request to have City Block. So that's where their voices can be heard. They can call their insurance provider and request to have City Block.
But if they're in a psychiatric facility, so I work at Brentwood Springs.
Mm-hmm.
So if they're in a psychiatric facility, do they have to sign an ROI if they're a City Block patient? They have to sign an ROI so we can release information to you guys that work.
Yes, correct. Yeah. I mean, federal law still. What we would do is reach out to your case managers there and say, "Hi, we're City Block. We got a ping when our members are there." And then you would have to talk to the member. Otherwise, we would have to wait until they were released, and then we would show up on their doorstep. Is what would happen.
Okay.
Does the member have to agree to go to City Block?
Yes, they do have to consent. Yes. Yes. So, I mean, they cannot consent, but their insurance company's really going to push them, because at the end of the day, as we know, it saves them, money from high utilization. So while I don't say the insurance company forces them, I don't ever want to say that, they are highly encouraged,
When do y'all be coming in?
That is a great question, and I'm an Evansville girl, so I'm pushing for that. So unfortunately, the state made it, a start in Indian Fort Wayne because, of course, they're bigger than Evansville. I am hoping by winter we are down to Evansville.
We're the third largest, so hopefully
Yeah.
they're already at 1 and 2. So
Yeah.
then they get to
Yeah,
serve.
so with that being said, I'm the marketing manager, so you have my business card. If you're interested, City Block is always hiring. I just filled a bunch of positions. So if you have healthcare or social work or mental health background, I will definitely be looking for people as we, come down into Evansville. Please look me up,
All right. Well,
Okay, well, thank you very much. And again, just kind of keep this a little bit on the down low. You will start to see things hit media. I think today, that's where I'm heading right after this, is I think for a full media release. But if not today, you will hear it by Monday.
I need you to make sure you mention me when that information is released so that when I can release it.
Yes, yes.
Well,
Thank you very much for having me today.
thank you. Well, I appreciate you, Amy. We're going to give her a round of applause.
I got it.
I was trying to have fun. Okay, let's scoot over just a little bit.
Yeah.
Make sure you get the donuts.
Yeah.
Just turn just a little bit.
You crop those
There
out.
you go, thank you.
Okay, thank you very much. Good to see you. Thank you, everyone. Have a great day. Sorry, I gotta run. Thank you.
Till next time.
Yes.
We will get. Did I see? Did I hear you say you want to be a Rotarian too?
I do, honestly. I'm hoping in the next month or two things calm down a little bit for me after school month.
Okay. Well, we always welcome you back. So please
Thank
feel free to
you.
come see us.
Thank you. Have
Enjoy
a
your
great
day.
day, everyone.
All right, everyone. Great session. Great thing about learning about different programs and organizations and companies within our community, and such a great thing. So we'll go ahead and get right into business. Keep us on schedule. We are ahead of the game, obviously. Here's kind of what our lineup looks like this month. Currently, Patrick isn't here, so we'll have to forego his orientation or introduction in the next meeting. Oh, let me go back. Our next speaker is our very own member of Laura Brown, that she will be speaking about United Methodist Youth Home. So we'll have her as our speaker for the 29th. They said we'll get to Patrick when he comes. He's been in training for his job, so that's the reason why he hasn't been here. So he said he's hoping that he'll be able to freed up. And
Does he need a fan?
he does.
You already got it.
I think he already has one. I think he already has one in there.
You already made
Oh,
it.
really? Oh,
Yeah.
yeah, I didn't make one.
Laura said she's going to.
Yeah, she has one too. And then we'll probably need to. Do we have any for our honorary members? Probably like Tracy and Aaron and Sheila. Like this.
We did not.
Probably look at maybe doing
I
that.
think we gave them, just a long time ago. Sheila,
She probably took it home.
It's in some drawer somewhere.
Aaron,
Yeah.
should we make Aaron as a honorary? Yeah.
Yes.
Her son.
So we need to look to see, because if not, then we need to get back his name. All right. All right, so just want to hit on spruce it up. Great job to the team last week on your efforts. That corner looks amazing. I've gotten calls from the Amy Freeman who's called me. So she's happy.
She's helped cry.
I was trying to get her to come work, but I guess she wasn't going for that.
She was really hoping that you were going to be there.
She was there for about 15 minutes.
So she was very delighted. I told her, she's more than welcome to come to our meetings or any of our events that we have coming up. So she was very happy about that. And then Ann from Red Cross actually said something about our sign yesterday. She sent me an email. She said, "Hey, I seen your sign on the corner." So it is showing the things that we're doing in the community. Definitely kudos to that team for making this happen. How long did it take you guys to do it?
An hour.
An hour? Okay. Well, thank you for doing it. Thank you for your service to the community. And it looks wonderful. So definitely give you kudos. You should also give yourself a pat on the back.
The next day, whoever does the bowling out, we got out there and mowed pretty much everything. So, I think we probably shamed them into it.
Good looking press, right? Good looking.
Well, yeah, because I kind of
Good
looked
deal.
All right, so we're going to transition to another point. So we have been looking at different types of membership options. So FOR is Friends of Rotary, and the other one is family membership options. So just to kind of give you a quick overview of what these two look like without going into lead. So the Friends of Rotary is pretty much like being a supporter of the Rotary Club, right? So let's say Amy didn't want to be a member outright. She didn't want to be a member outright. She said, "But I will be a friend of Rotary, and I'll give you guys, $50 a year or $100 a year, and you can count that as kind of like a membership." They're just not.
No voting rights, basically.
No voting rights, you can't become an officer, none of that stuff. All right. So the family membership side of it is, it's like you want your spouse to be a member, you can add them as an associate member under you. So you would be the primary, your spouse would be the associate member, okay? That's a pretty interesting concept. Remember our, if you can go back to our changeover dinner, do you remember Sharon and Chris and Tony? Antonio? Changeover dinner? Yes, our assistant district governor.
Right.
So one of them is the primary member, and Chris, who's our president for the nightclub, I think he's an associate member now too. But so they've been able to work it where you can get, you have your primary member, right? That falls under you, which you're the primary member, but you got 2 additional family members under you in order to become part of the club. Now, the part of that is what's the price point looking like on that? So I guess for the family of Rotary, I would ask, what does everybody feel like would be a decent price point for an annual membership? Now remember that they're not a full-fledged member. They're more of a supporter of the club. So
Do we have any idea what the expenses would be for the club per family member? Like, do we need to pay dues to the Rotary International per family members? Or
no, it wouldn't count. No, it wouldn't count for actual membership numbers.
Mm-hmm. And so, like, a normal membership would be
$125 every 6 months, right?
125 with regular, with 30 and 35 and up, young
Right.
professionals is 75 every 6 months.
right. So,
So if you would break that, let's say we did say $100 a year for friend of Rotary, it'd be $50 every 6 months. 6 months, where they can just pay the $100.
okay, $100 a year as opposed to a regular membership would be how much?
$250.
$250.
250 or 150 if you look in your
Yeah,
professional.
see, that kind of makes sense to me, like slightly less than 50%, because it's got, like no voting rights, there's not much to it, you show up, it's kind of a social thing you can do, so it's a small fee. That number kind of makes sense to me off the top of my head. I don't have much more than off the top of my head to go off, but Walter, you have any kind of ideas on that?
So right now, right now, a member like all of us are paying $125, that's $250 a year. I would suggest maybe $300 if you wanted to do a family.
So that would be just $100 for that additional family member.
It's $250 now,
Right.
and
then we pay another $50.
You pay it $300 if you have a family. In other words, if it's $125 every 6 months, it's $150 every 6 months.
So what does everybody think about that? So that would be, it'll be $350, so it would be $150 every 6 months if you were to have yourself and that family member.
That sounds good.
So let's just simplify it, like $100 more a year brings as many family members as you want from your immediate family. And that would
Because you could have brought them as a guest and nobody would ever say anything about it. They could have come every time as a guest.
I'll say, and the other part of it is they can also serve you as your alternate. So, which means that if you aren't able to come, you can always have your spouse come in your place.
And exactly.
Can they do like proxy votes, like if there's a vote on something in the club, or like it wouldn't count, like if you weren't there and they attended in your place, and then like they get served to vote for you, or?
There were some concepts that I sent out yesterday that we can explore. I mean, it's really essentially up to the club as far as what they want to do on that end. You're talking about like voting rights and all that stuff. Yeah. Some clubs do, some clubs don't. For the friend of Rotary, they don't have voting rights, but for the family membership,
They should have because they paid something.
they should. So I mean, we can make it a possibility.
Yeah.
I mean, if you're one unit, I'm sure you're talking about stuff like, hey, what do you think if we talk about this at Rotary? Are you good with it? Oh yeah, sure.
They're both going to look the same way.
Yeah. Typically. Okay. So that's why I understand everybody. We're good with passing the family membership program at $300 a year, and then introducing our Friends of Rotary program for $100 a year. Is everybody good on that?
or we could just make it one thing. It could be $100 a year for either Friends of Rotary, $100 a year for family. Wait, am I saying this wrong?
Oh, is that
Well,
just
the
a-
family is different because
Yes, it's
you've
different.
already got a member that's
Okay.
already paying
Right.
$250, and we're just
So
rounding it up.
Let me elaborate on this. So essentially, you would want, like, let's say Amy, our guest speaker, just
Yeah.
paid her. She said, okay, I want to be a Friends of Rotary member.
I get it, I get it now, I
So
get it.
she would eventually that she would become an actual active member and pay
No, it makes sense what you're saying, I get it.
and pay the actual 300. If she added her and her husband 300 a year.
Yeah, no, I
You
get
get what I'm saying?
I get it, all right.
Because yes, she doesn't have voting rights, but if she doesn't have an officer, she can't become an officer. But let's say, like she says, she frees up her time. She says, you know what, now I'm ready to go ahead and make the step and become an active, full-fledged member. She'll go ahead and pay that full, $250 or $300 for her husband, and then she'll be a member. And so it's another way to bring people in, and build a club even more. Does that make sense?
Yeah, that makes sense.
Yeah.
Got it.
So we're good on that. So 100 off for Friends of Rotary, 300 for all together for family. Okay, I guess I don't know if I can hit the dome there or not. Okay. All right, here's up. FYI, we do have our district grant. The money's coming like any day now. I don't know. I think Betty said that they're probably going to mail it like they did the last time, right? They'll probably mail the check. She said it should be going out any day. They're waiting on approval or more information from Rotary International, the head honchos up there. And just to kind of get their preface, what we decided, there are some shelter houses. Well, I say shelter houses, so they're like kind of like, see that right there?
Yes.
There are like two of them. So they're really dilapidated and need to be updated, and we needed to do some updates on it. So
Do they have solid roofs, or are they?
It's kind of like a plexi.
plexi, like a plexi,
It's
yeah.
like a plexiglass.
Probably ought to be done in metal. You know, that ribbed metal like you do the sides of buildings.
Yeah.
It's for shade and like if it's raining, whatever, the residents sit out there and talk and smoke, whatever.
So it's great branding for us. We had already agreed with Ozone that once we were done with the project, we would go ahead and put our branding on those houses, so that'll help as far as getting us out there even more. But we did kind of cost probably before, like when the application was due last year, I think it was like close to $4,000. So the district obviously is going to match us 2. We're going to put up 2. The district's going to match us 2. And then, like I said, that money should be coming in the next few weeks. But we do need to decide when we want to actually do the event. Now, she did say, and granted, I know she's changed positions in organizations since then, so I can't necessarily speak on her behalf, but she was thinking about actually getting some of the board members for that organization to help with the labor as well. So,
Is that what we want to do, or do we want to get a contractor? Did the guys know how to do a metal roof or do one of those? A lot of times those are built in a factory and just put out. When,
I guess we probably need to have some kind of costing process to figure out kind of what's the most efficient route going forward. But I'm definitely not an expert on that.
I have a friend, his name's Eli, he works for my uncle. My uncle owns Midwest Contracting. And Eli, he does some side projects and stuff. He just redid my mom's interior farmhouse. I can talk to him and see if he can give me a quote on how much he charged to put one together.
That'd be excellent.
Yeah.
let them know our budget too.
so
And then you
Does
can give us
it-
options too.
is the basic structure, the framework, is that steel or is that wood?
It's wood.
Wood.
So you need
No,
to
sorry,
replace
steel.
the
No,
posts and
it is
everything.
steel.
That's the
Everything needs to
It
be
is
steel.
I think it's steel.
It is, it's metal.
I believe
think
it's,
it's not, I think it's an okay shape, I'm not sure. It's mainly the plexiglass and stuff, and then, maybe spruce.
Well, I mean, we could spruce up and put like actual like borders around it and stuff like that. So we could look at that option too.
If it's steel, he won't be able to do anything with steel. If it was wood, he would, but steel, you have to have like a steel worker and stuff to be able to do that, like a welder.
I tell you what, give him the chance to kind of check it out and see what he can do, and we can kind of see.
Yeah, I'll text him. We'll go out there and look at it and see what he can do.
And then obviously we come out and support as far as any mechanical worker and stuff like that. So we'll get with Joanna to see exactly what this looks like as far as labor, which I really don't see it being that bad. I really want this to be like a one and done thing. Like we just take it one day, get it done. We can invite all the other clubs around the area and
It'd just be good fellowship for everybody.
win for everybody. So even our Interact Club.
Well, there's another option too. There's a group, DC Metal, makes metal. They're the Amish people up in Montgomery, Indiana, and they do extraordinary work. They do it in just no time, and therefore they can charge a whole lot less for their labor.
But you got to keep this in mind.
For me.
You got to keep this in mind, Dave. There has to be some type of service component. We just can't write a check and say it's done. There has to be some type of component where we're showing that
We
we're.
have to do a little.
I mean, so showing that we're, hand in or something.
Well, the steel framework can be sanded and painted with the rust inhibiting paint.
Wasn't the deck for United Methodist Home, wasn't that a contract and then we came in and like provided support on that? I think that's how that would be. So it could be a similar fashion on that end.
Yeah, it could be, we hire a contractor to do all the heavy work and then we go in and spruce it up and add flowers and make it look nice.
How did that go? Because I heard different
All the
things.
work was done by volunteers. Yeah.
All of it.
Yeah. Yeah. Was the, Old North Church on Stringtown, they have a dedicated crew from there that does a lot of work.
You know what? This could be an opportunity to partner with the innovation school, the one that has like all the different trades and stuff. Yes, the Southern Indiana Career and Technical Center, get some students out there to help do it.
Yeah, that would be great for them.
Yeah.
So what I would say,
Neighbors,
I would say at this point, probably let's put our feelers out there to see who wants to be involved in this project. Everybody has a good understanding of what the project looks like, correct?
I need to go out and look at it.
Yeah, so just drive by, you'll see them, they're right outside in front of the shelter.
How many of them are there? Just two?
The innovation school?
Oh, I will be going that direction later, maybe.
Yeah.
I may just try to drive by and see what, I was thinking it was metal.
I know it was metal too.
Yeah.
I'm very good.
Yeah.
Yeah.
In my.
All right, so we'll be with more details on that. Save the date if you haven't already. Pike Polio is coming October 24th, which is World Polio Day. As you know, Rotary has been really big about eradicating polio as we partner with the Bill and Melinda Gates Foundation to do so. So this is what this is going to look like. Bubba 33 is actually going to open up for lunch for us on that day, and they typically don't open for lunch on Mondays. Actually, they don't open for lunch unless it's Friday, Saturday, or Sunday. That being said, the managing director, director manager, she's the head honcho of that location. She said she will open it up for us. 10% of all proceeds for that day will go towards donating towards the Polio Plus Fund through the Rotary Foundation. All right, so any sales that we have on that end will go right to give it to the Rotary Foundation for the Polio Plus Fund. And then the other side of it is to make it more of an interactive component. Now, see, I had initially envisioned us doing a dunk tank, and I thought about it, and I was like, it's going to be October, it's probably going to be cold, the water's going to be cold, probably.
Intro to Polio.
And, obviously from the cleanup aspect of it, right, you had to go, you don't want to trek through the restaurant, drenched or wet and stuff like that. So I came up with another concept. What about pie throwing? You can still get like the little mini chicken pot pies, whatever, to get the crust, get some Cool Whip, which would be really inexpensive, and you still get 3 throws.
That's what the kids came up with Monday. We met our club and they thought about the pie show.
Hey, they do a similar thing at Boston.
Yeah.
How your favorite teacher? Or
Yeah.
Well, we said administrator.
there you go. All right. That being said, see, I love that innovation.
What if you use just Cool Whip or that's easier to clean up.
Yes.
Yeah.
And you don't even have to have a crust, you just get a little aluminum pie.
Yeah. And then just put your Cool Whip
Well,
or your.
I can get 6 of them for $2.95 from Walmart. It's a whole 6-pack for $2.95. A little small, 6-pack. We'll make money. Easy. So that would be actually our fundraiser. as well in our service project. That'll count as a service project for October too. So we actually will get 3 service projects done in October if you, well, I'm not speaking about the other event that just came up. Well, 2 currently until we announce this next thing. So that being said, I want to know who can be there for the whole pie thing. If you can't, that's fine. I took off a whole day Monday to do it. But also, we're going to need people to pie. So if you know anybody that would be interested in pie throwing or getting a pie thrown at them, all we're asking for is an hour commitment. Okay? That's all we're asking for. We'll give them, kudos, and I want to say I wouldn't be against giving them like a meal for getting pie for us, but I guess that was something that we would have to figure out from the board perspective. And that's.
I can be there to help. I'm not sure, what time are we starting? 11?
Yeah.
Till
I'm probably thinking the pie throwing is probably going to like 6 or 7.
p.m.
Really.
Oh yeah, I could probably be from 11 to 2.
Yeah, because they close at 10.
So it's an all day thing.
It's all day thing.
I could probably be there from 11 a.m.
And I've already put it out to our district leader, so I told Lance that if you wanted to come down and get pie, we could probably get a lot of interest with him getting pie. Having the district governor getting pie on World Rotary Day. So I put a cricket in his ear yesterday, so he might bite at it.
I mean, I could probably be there after work until close. That's not a big deal.
If you want. So I'm thinking as far as like the materials, I already have a table. I have like Rotary stuff that we can talk to people about Rotary and polio and what we've been doing with polio. And then,
We want a couple of posters for the end polio now.
yeah, actually, Signorama got them working on yard signs. So they're gonna have some directional signs. And there's gonna be a banner outside above the 33 because there's like that gate. If you go to the light, you see that gate. The banner to direct people to let them know what's going on so they can come and drive through.
I was gonna say, I've been there once.
Where is Bubba's 33?
It's the old Logan's
Yeah.
location in that corner.
On the
Bird
Park,
Park.
Lloyd,
Okay.
right in front of Walmart. Right next to.
It's a good location too.
Yeah, that's what I'm saying. So this works out perfectly. So I think we'll get a lot of interest that way. I'm going to work on I'm sure all of us are going to work on the social media aspect of it to invite people and draw interest.
Talk about signage.
Really excited about it. Grateful for everybody for the opportunity. Now, do we want to talk about the other event groups?
Yeah, we can.
Okay.
We may have a second opportunity that week. I've been talking to the folks from People downtown on Main Street about doing a planks for polio. And I think they're interested in doing it. That'd be Tuesday from say 5 to 7.
25th from 5 to 7 at Peepo.
Yeah, they'll get back $1 for every drink that they sell. Every order during that time, so.
Oh, is Steve involved in that? The owner of People?
I'm sorry?
Is Steve involved in that, the owner of People? Does he?
Yeah, they were talking to him. I talked to him on Saturday,
Yeah.
the manager, and they were gonna talk to the owner about it.
Little footnote about this possible event here, this picture polio thing. That restaurant would be open at the time they're not open. During the time me and Chad went and checked out the venue, people were showing up trying to get lunch, and it's like, oh, they're closed, and they're leaving. It's like, if they open during this time, I think we're gonna have potentially a really good draw. So it might be the kind of thing, like, the more we put it out there, the better it's gonna do,
Yes.
I really feel like it could draw a lot.
So I have Cabana, which is like a PR advertising type of thing. I can make like a thing and we can take it into local businesses if anyone has time and just advertise it too.
I'll tell you what, you make that concept up, I will clear my schedule so we can go ahead and do some outreach.
Yeah, sounds good.
Talk about all
And
the
then,
events that we have.
My brother is really good friends with Steve too, so I
Oh,
can,
good,
People's kind of like your spot, so.
good.
Yeah.
All right, so it looks like we got the division in place. Great thing.
You talking about the t-shirts?
Oh, yeah, Hoosier Screen Printing is going to provide t-shirts for the event. So they're going to draft some In Polio Now shirts for not only the team at Bubba 33, but also us as well. That's why I need everybody's t-shirt size. And if I haven't gotten you already, please feel free to find your name and put your size.
Send it to you, isn't on there?
Yeah, it's on there. I need everybody that I need is on the blank. It's blank. So that way I can go ahead and send it to Kate and she can actually get it ordered or get it made for the event. So it looks like it's going to have probably this logo and probably like Bubba 33's logo since they're
I like that.
are hosting, and Hoosier String Spring logo and the Surface Apparel organization for the Monday event. I'm not sure if you want to look at doing something separate for Pints for Polio, but we can.
Yeah, something, I mean, it could be just as simple as that in polio now, on a t-shirt, you know, with our logo and there's your screen print.
Now, she's only going to be able to donate the shirts for Monday. I have to talk to her about trying to do something for Tuesday. Yeah.
Hey, Bruce, I wonder if, has Steve this year, he didn't do his beer soup that he normally does. They just did one this past weekend, but I think that one was hosted by the arcade bar down there. But Steve didn't do his beer soup this year, so I wonder if he's willing to make it like an actual beer soup.
No. I need to contact them today and see if they made any progress on it.
Yeah. Who, do you know who you talked to?
CJ or DJ?
No, I know who you're talking about. Yeah, I'll go talk. Yeah.
Yeah, Kelly.
All right, you two make it happen. You can make
We'll
it
talk
happen.
about it. Uh-huh.
All right, love it. Then we'll just report something at the next meeting when the work presents. All right, Rotary Day in the Park. It's coming up. I want to know who's going to be there.
What's the date?
24th is Saturday.
So, what is Rotary in the Park?
It's our social event. We're going to be grilling out in the park at Musselman. I just need to know, are you going to be there? Because if you aren't,
I'm not gonna be there.
you're not going to be there. Okay? I need to know, because if we're not going to be there, then I need to go ahead and cancel the event, because we have 2 socials scheduled next month.
Yeah, I can't, yeah.
And I don't want to just be sitting there grilling burgers and by myself, you know? I mean, granted, we may have some people coming, but it would be good to have.
Is that a Saturday?
That is a Saturday.
Yeah, I can't be there.
That's on a Saturday, you say?
It's a Saturday.
A week from,
Probably not.
it's a week from this coming Saturday.
Yeah, I've got 2 conflicts in that day.
Okay. All right, so that's when the majority of our membership here. So what we'll do is we'll go ahead and cancel it, and you'll probably get an email saying we canceled the event. We will reschedule at a later date. Okay.
Sounds good.
All right, so this will be canceled. All right, because we got like 2 social events going on in October, so we'll make it up. Anything else? We've covered a lot. Bruce.
Tomorrow morning, Interact is helping us do a habitat.
Yeah, we got 8 students coming out. So we'll be at the breakfast in the morning at United Way, Dale Kim, and then they'll come on over.
Okay. Very nice. We didn't get invited to the party.
Oh, you get it right.
Poor little fellers.
Good deal, yeah, looking forward. I'll let the guys know
Okay.
who all is coming out. They haven't told us who it is.
Okay.
Now we know.
Now you know.
Yeah, looking forward to it.
Which day is that?
8 kiddos for myself.
Tomorrow. Okay.
And they asked us to switch to Friday, from Wednesday to Friday, so we could, have somebody to work. Oh, did they?
Hey, Andrew, did we send that check to the district for Ryland for?
No.
We need to get on that. And I think that's due by October 1st.
Yeah.
If you didn't know, we went ahead and voted, and we're going to send 2 students from Boston to Ryland, and the nightclub's going to send 1.
Yes.
So we're looking at it's $200 a person now. If you didn't know that, it's $200 a student. So we went ahead and want to send 2, and then nightclub's going to send 1. And that's already, the application's already been sent up to the district.
Where are they going? I'm sorry.
Bradford.
Bradford Woods outside of Bloomington.
Yeah.
Oh.
And it's an unbelievable experience. It's
Yes,
all
yeah.
learning how to work together, and most of the things you can't do by yourself, you have to have help. Like,
Amen. Say that again, Dave.
by yourself, you gotta have help.
Say it. All right. Holds true in adult life too. Yes.
Our block party, we're having a big fundraiser, not tomorrow, but the following Friday, so a week from tomorrow at United Methodist Youth Home. And if any of you want to stop by, it's during lunch hour. It's from 11 a.m. to 1 p.m. We'll have food trucks, there'll be inflatables, a selfie station.
What day is that?
Friday, September 20th.
Maybe we can make that our social instead.
That would be awesome because we need volunteers. You guys are all welcome to come, but also if anyone would be interested in some light volunteer work, we're looking for 2 to 3 more volunteers for the event.
Okay.
What day is that?
Yes.
What
The
time?
23rd.
Friday, September 23rd from 11 a.m. to 1 p.m.
We can count it as a social and a service project.
That would be awesome. I mean, we would love to have you guys have the club out. This is the first ever time we've done this, so it's inaugural, so we're not sure exactly what our attendance is going to look like. We're hoping for a great turnout. We've tried to promote it in all channels possible and really start ahead of time, but it is, with it being new,
So it started at 11 and
it goes to 1. So it's a 2-hour lunch.
Okay, Friday, September 23rd, United Methodist, 11 a.m. to 1 p.m. United Methodist, what's the name of the exact place again?
United Methodist Youth Home.
Youth Home, okay.
UM1H.
Go ahead. I hope you're writing it down. Put me down as tentative.
Okay, that would be awesome.
And we can count that as a social and move the Rotary Day.
Yeah.
Yeah.
Absolutely.
Perfect.
Okay.
I'd probably be there early because I gotta hook somebody up and drop them off at school.
Hey, did you get with JoJo? Andrew, did you get with JoJo? Did you get with JoJo? Georgia. Friendship? Diamond?
Friendship Diamond.
Website?
What's up? Oh, a call, no answer. I'll have to actually stop by and see if I can reach one, please.
All right. Awesome.
Good to see you guys. Go.
All right. Perfect. All right. So we got that hashed out. Anything else?
What time do we need to be there next Friday?
So we do need help with setup. So if you want to get there at like 9:30, 10, if you would be able to help us set up for the event, if you're just coming to help during the event, because we'll kind of have people floating around. There's different stations we have, and there's a couple where we do need someone kind of manning or overseeing the station. Then that would just be from 11 to 1.
Okay.
Or as little or as long as you're available. We just need hands. So,
Okay.
yeah.
I should probably be able to make part of that.
Okay. Yeah, that would be wonderful.
I was gonna say, so do you mind if I know it's like your baby, but do you mind if we recap that and make it our social for the month?
Oh,
And then
absolutely.
we can be able to draw interest.
I would love for us to do that.
Okay. Because we can recap and just make it our social
Yeah.
for the month and then redirect.
Oh, that'd be
Interest that way.
fantastic. Yeah, I would love that. And there are t-shirts. We're selling t-shirts with merch, t-shirts, hats, and then we have swag bags. So that's everyone's little bag of goodies for free.
I love swag bags.
Yeah. You have those.
I don't think it's pretty good, but who knows?
All right. Anything else? Anything else? Nothing else. I will say, hey, we are looking for a fundraising chair, so we're going to need one because we need some ways that we can be able to fundraise as a club. So.
Well, and with the foundation, we fundraise for the foundation, for our club. Who all, I was just real quick. I was just, the Rotary Foundation. The sustaining members. Who all is a sustaining member? Where we give like $10 a month. I'm doing that.
Yes.
I have.
Okay.
So, Chris, if you want to speak a little bit about the Rotary Foundation, just for our newer members, as far as the impact that it has and what we had committed to based on our club visioning last year.
I don't have any extras of these little pamphlets, but the foundation, they have different areas of focus: peace building, disease prevention, water sanitation, and hygiene. I didn't realize until I got into Rotary how big Rotary was in water. And then, of course, maternal and child health, and then just basic education, literacy, community, economic development, and environment. So, they have, really 7 areas that the foundation, focuses on. And, I want to try and start getting more information out about all of that. And then I'll email out to everybody about, the different ways to donate to the foundation. How's that sound?
Perfect. Yes, so she mentioned the Rotary focuses on that based on our areas of focus, but there's also the Polio Plus Fund, and then there's a general fund that you can contribute. So there are various ways you can get back to Rotary, and it goes to different.
A disaster response fund and the Polio Plus Fund, yes, and then the annual fund share.
So like when Bruce's presidency with the Polio Ukraine thing, Rotary actually made a separate fund to be able to help with efforts in Ukraine. It's actually still going to this day. So they built a whole different fund to be able to help Ukrainians or Rotarians who are in Ukraine with what's going on with wartime effort. So definitely easy way to get back. $10 a month. I mean, I spend more than that on a daily basis anyway. So if you can.
Almost that over it. And I'll try to get some more of these to get out to everybody. Okay.
Okay. All right. Now it's time for Happy Dollars. What are you happy about? I'm going to go ahead and donate mine for like the last 2 weeks because I forgot to get mine. So I'm donating it. I'm happy all the time because I'm in this company with all of you.
I am happy. When we can get up and put our feet on the floor, it is going to be a good day. When you think about who can't get up and do that, God has a plan for all of us, and it's going to be a good day.
Great. Yeah, this has been a great meeting.
Excellent.
Very, very happy about that. We've got a lot of energy in this group now. So.
Hey, I had my coffee.
It's good. It's good to feel the energy, and we're all having a good time too. So
I was happy to hear that we got some feedback on the corner we cleaned up, and it looks so much better.
Yeah.
Yeah, I was happy to learn about that city block. I mean, it's an interesting concept. I haven't heard from it before.
I haven't heard of that before either.
Yeah, I love our speakers. I love this group. I look forward to coming. I didn't realize it was just every other week. I have to call him and say what happened. and for you spend all that money for breakfast, all you have to do is go to Wendy's. It's $1.49 for a biscuit sandwich, and seniors get free coffee.
Well, normally when I take my 6-year-old granddaughter to school, I take her a lot. Once a week we'll go through McDonald's and she eats hot cakes and sausage and
We're behind on time right now, so we can talk about that after. Ken, what are you happy about?
What am I happy
Next
about?
time, Joe.
Well, I'm happy because my family's doing well, and all of my grandkids are back in Evansville.
yeah.
So it's been a good time.
I was gonna say the same thing, I just put my money down in the box there, but just happy that family, or again, like we said, family is doing well, everybody's healthy, glad to be a part of such a great group here, and glad that our kids at school are real enthusiastic about helping and giving back.
You don't have to look at doing some joint events.
Yes.
Yeah. I'm thankful for everyone in this room. Like you have already touched on, just the energy here helps me to go in rejuvenated, refreshed, do my job better, and to my full potential. The ideas we share here to come together, collaborate to do better for the community. I really appreciate everyone in this room. I'm also additionally thankful that this weekend I'll get to visit my sister up in Indianapolis. I don't get to see her too often, so me, my mom, and my younger sister, we're going to go up and have kind of a girls' weekend and
Rotary.
Road trip. Yeah, to get away from it. So that'll be a nice visiting opportunity.
Thank you.
Well, I'm happy about a lot of things. I'm just a happy person. But I will say, I'm very happy to hear about the Pints for Polio, with the people wanting to get involved. I've been around the people for a long time. My brother was a bartender there. I think JT is the one that you talked to, JT Warren. So I'm really happy about that because hearing that they want to get back to the community just makes me happy.
Good.
So, yeah.
And anytime we can drink a pint.
I'll tell you, I just love the Peak. It's such a small.
I haven't been there in 1,000 years.
Yeah, if you've never been there, you have to go. It's an experience. I mean, they have local artwork on the walls, and they're great. So
Awesome.
Little side streets.
All right, well, our time is ending, but hey, we want to thank Venue 812 for allowing us the space and being our host sponsor this year. And as you know, we meet every other Thursday, as noted on Van Avenue and outside. So feel free to see us. And we have officially adjourned.
I'll drop this by your husband. I'll let her be. I'll bring them over.
Thank you.
We have our dinner.
Yeah.